For the last couple of years, we learned that we as a plastic surgeon, our job is not only to get rid of the wrinkles, is to prevent the wrinkles. There are different ways to do regeneration by different cosmetic products, laser, radiofrequent, chemical peeling, PRP, and of course microneedling. The reason I choose microneedling for the last couple of years, because if it's done in the right way, we can have a very good effect in regenerating the skin. Now, the whole trick of microneedling is that, as we know, everybody knows here because everybody's doctors, that microneedling makes inflammation, as inflammation makes collagen. Now, what we do with microneedling, we try to give different products to the skin. And as we know, making straight needles through the steratoium corneum, we can give as much as 40% chemicals or creams or vitamins to the skin. As we can see in these slides, if we only put topical creams on the skin, approximately 0.3% of the cream is absorbed by the skin. But if we combine it with microneedling, approximately 40% of the topical creams are absorbed within the first 3 days. Now, if we try to do the staining by Mason trichome, we can see a control IPL and a microneedling. And it is, frankly, as we can see with microneedling, we get more induction of collagen than IPL. Now, the kind of microneedling that I usually prefer to use is called DTS. What is DTS? DTS stands for Disclet Therapy System. It's a very kind of microneedle made by a company called Genosys. The reason we like to use DTS because it has approximately double the number of needles compared to other companies. At the same time, the needles are very small. It's approximately 0.2 millimeters, which makes it less pain. At the same time, it makes less trauma to the skin, and at the same time, it causes less loss of water from the skin, so the healing is much faster. The other very important thing about DTS and Genosys is that the needles are made in 6 degrees. That makes the insertion to the skin vertical. That means we do not scratch the skin, and this is the reason with this kind of needles, the healing is much, much faster. One more thing that is very important, that what kind of needles and what kind of microneedle you use is the shape of the needle. As with DTS, we know the shape is diamond, and with lots of other products, the shapes of the needles are circle. It just as like plastic surgery or any other suturing material which we use. If the needle is circle, it's much, much more difficult to pass through the skin. And this is a reason we think DTS with the diamond shape needles, it hurts less and is powerful, and it does not cause any damage to the skin. There are different products depending on where we want to work. On the face, on the eyelids, or on the body, and at the same time there are different products depending what we want to do. Whether we want to enhance regrowth of the hair, whether we want to combine it with PRP, whether we want to get rid of the wrinkles and stretch marks, or whether we only want to reduce the scars. The basic way of doing skin rolling is that usually we put the creams, as everybody knows, then we try to use the rolling, and sometimes we combine it with different products. The products can be vitamins, can be minerals, herbs, or anything, and then we put a PHG mask, polyhydrogel mask on the skin, which makes soothing of the skin, and at the same time it gives lots of vitamins to the skin, and then we use, of course, some sun creams. Now, the way we do it is a very special way. We call it 4-in-1. What does it mean? The 4-in-1, later on I'm going to show you a small video about it. That first, just like any other dermal rollers, we clean the skin. Then we use a special machine. It's called jet peel. Jet peel is a very special machine that with very powerful pressure, water, lidocaine, and vitamins, we try to get rid of the last layer of epidermis, and then after doing that for 10 minutes, we use a special mask. It's called Genosys CO2 mask. The Genosys CO2 mask, what it does, that it makes a very mild chemical peeling of the skin, making it ready for DTS rolling. Now, usually the rolling, we do it either with PRP or one of the serums, which of course we can get it through the Genosys company. That takes another 10 minutes, and then after doing that, we use a PHE mask again to smooth the skin. Later on, I will show you on the video how we do the dermal roller, which is very important, the way the dermal roller should move. I'll show you a couple of pictures before and after. This is acne scar done after 4 months of treatment, only dermal roller and some creams and serums used for the skin. For stretch marks, alopecia. Alopecia is done in this one, dermal roller combined with a very special Genosys products called HR3, and of course with some minoxidil. The reason we put this picture because this person has very little hair, and the effect of dermal roller you can see much better with this picture. Of course, with this one you can see a very beautiful effect of dermal roller combined by different products. Skin rejuvenation before and after. And these are the pictures that I, as a plastic surgeon, I can see the effect of doing facelift, but at the same time try to change the texture of the skin. So we do not overdo the facelift. We do a very simple mini facelift, and then at the same time, after the operation, once the healing is done, for 2 or 3 times, we try to rejuvenate the skin to get a better texture of the skin. Again, we can see a beautiful change. A 55-year-old lady, the shape of the mouth or the eyes did not change, but at the same time, we can see the texture of the skin combined with a mini lift and the effect of it. Beautiful lady, again, we did not make her face unnatural. Facelift combined with microneedling and rejuvenation of the skin. And now, this is a video which is going to be only 2 minutes. This is the jet peel which we mentioned it. With water, with very powerful pressure, we try to give to the skin vitamins, lidocaines, and we try to get rid of the keratin layer, the last superficial layer of the epidermis. This is how we give the vitamins with it. Then we use the CO2 mask of Genosys to peel the skin. Now, it all depends on what kind of skin. If the patient has very bad skin, we use some chemical peeling, but usually we're happy with the CO2 mask, which we leave it for 20 minutes. Now, the direction of the dermal roller, this is a trick in it. We should do it in different direction, as we can see, in vertical, horizontal, and oblique positions. The whole idea is not to make pain. The myth that they say no pain, no gain is not true. Try to do it very, very superficial. Try not to make too much pain, and try not to bleed the patient. And these are the serums we use. And again, we do, after putting the serum and massaging the skin, again, we use the dermal roller. And this is, we do it for 10-15 minutes. Very gently, and we always, when we change in the direction, we always lift the dermal roller because we do not want to scratch the skin. There are special kit for around the eyes. These are the 0 to 0.5 milli derma rollers with some special creams, serums, and patches, which is at the same time we use it around the eyes. And then after we finish with the derma roller, we put the PHG mask and we leave it for 20 minutes or sometimes even longer. It neutralizes the skin. And at the end, we put some sunscreen. Thank you very much.